Hey guys, Lakyn here, registered nurse. I'm here at Titan Nutrition and I'm going to be talking about blood pressure, so let's go ahead and get into it. Okay, so blood pressure is basically just what pushes the blood throughout our body to all of the vital organs that need to receive it. Most commonly, blood pressure is referred to as systolic over diastolic. Systolic is when the heart is squeezing to push blood throughout the body. We like that top number to be about 120. The bottom number is diastolic. That's when our heart is at rest. We like that number to stay about 80. That's our ideal pressure, is 120 over 80. So what happens, our blood vessels dilate and constrict. When they're dilated, that means our heart is more at rest, we're more relaxed, our heart doesn't have to work as hard to get the blood to the vital organs that need it. When we have high blood pressure, our vessels are constricted, causing our heart to have to push a lot harder to get our blood to the vital organs that need to receive it. The reason that blood flow is so important is because blood carries oxygen and all of our organs need oxygen to function. All right guys, so we talked about what blood pressure is. Now I want to talk about why it's so important. High blood pressure can ultimately affect the heart by causing stress on our blood vessels that lead to the heart, making them less elastic, which will cause more stress and throw us possibly into a heart attack. What a lot of people don't know is that hypertension can affect the kidneys as well. It can throw our kidneys into a kidney disease or even kidney failure. The most common one we all know about is stroke. High blood pressure can lead to causing blood clots in vessels that lead to the brain, ultimately causing us to have a stroke. Obviously, to know if we have high blood pressure, we have to check it. You can get a blood pressure cuff basically anywhere. When checking your blood pressure, they recommend you do it at least twice a day, in the morning, waking up before you've had anything to eat or drink. Take it at least 2 or 3 times just to get the most accurate reading. The second time they recommend to take it is right before you go to bed, and make sure you're still taking it 2 to 3 times for the most accurate and average reading. If you are wanting to address your high blood pressure, please consult your physician. Now that you've consulted your physician, here are a few things I recommend trying to prevent high blood pressure. As you've seen in multiple other episodes that we've aired, it is very important to move your body. Moving your body not only prevents high blood pressure, but also keeps your heart in good cardiovascular health. Sodium is a very vital electrolyte for our body, but it can also cause high blood pressure. Obviously, everyone's sodium intake is very different depending on activity level, age, underlying health, anything like that. So definitely consult your doctor before cutting your sodium or changing around your sodium intake. Sodium is going to be found in higher amounts in processed foods. That's why I definitely recommend sticking to whole foods if possible. Fresh fruits, fresh vegetables, proteins, just anything with single ingredients. I hope you learned something from this episode, what high blood pressure is and some ways to prevent it, and you can implement some of these into your everyday life. Make sure you're following me and Titan Nutrition on Instagram, and make sure those post notifications are turned on so you don't miss the next one.